continuing to wait for folks, Senior Advisor in a Food as Medicine colleague in the Office of the Assistant Secretary for Health at the U.S. Department of Health and Human Services. Dr. Kofi Essel is the Director of Food as Medicine at Elevance Health. Ade Briones is the Vice President of Policy and Research for Native Agriculture and Food System Investments at the First Nations Development Institute. And Kathleen Merrigan is the Executive Director of the Sweetie Center for Sustainable Food Systems at Arizona State University. So thank you all for joining. This is going to be a great discussion, and I'm excited to see you all. Ade, I think I'd like to start with you first. And you and I have had many discussions over the years, and I've heard you say that, health is often considered sort of this individual responsibility, but the way we talk about health is often framed in terms of community or population health. Can you explain what that means and why it's important to make the distinction?
Absolutely. Good morning, everyone. Thank you for having me. Thank you, Danielle and Lindsay. I look forward to the conversation today. I have the best job in the world, and somebody can fight me for that comment. I work with tribal communities and indigenous communities across the mainland, Alaska and Hawaii. And during my tenure working with organizations and tribes and communities working in food, the most poignant takeaway that I have is that our communities are strong. Our communities have knowledge. Our communities have the ability to not only heal our health disparities, but even heal institutional havoc that has been caused over a long period of time. And what I've learned in my interactions with the tribal communities that I work with is that often we are told that our populations are the least healthy. Like, we have terrible statistics when it comes to chronic disease. And yet when you go to these communities, we're still very much eating together. We're still very much growing in indigenous fields. We're still hunting. We're still gathering, and all of these things don't often connect in Western institutions like the medical field, or even in education institutions in the school. Like, often these concepts about what health means to tribal communities and what health means in the Western sense don't connect. And one of those being that we are all responsible for our own health. Going to the doctor and addressing your diabetes, when really, when you go to a community and there's an entire community that may have this health issue, it becomes an institutional one. It becomes one that is not just based on individual choices, but one that is based on community experiences and maybe the lack of access to some institutions, and so we have to build our own. And that is like a lesson for the world, is that when your community is healthy, the likelihood of the individual in the community is going to be healthy. When the environment is healthy, the likelihood of that community in that environment is going to be healthy. And so all of these things are connected, but we often miss that when we're just looking at health from a Western perspective that only focuses on the individual.
Thank you so much, Ade. And I love that you made the connection between the health of the environment and the health of communities. It's really important. And also, that indigenous communities are strong, and breaking that stereotype of how a lot of people, especially in the United States, think about them, that these communities are strong and that they can heal their own health as well as the institutional havoc that you described. I think that's a really great point. Thank you so much. Erika, if I can turn to you now. Food as medicine, and you and I have had this discussion as well, can mean so many different things to different people. Some of us, refer to it as, interventions, and then there's others who think about food as medicine really in a broad way. Can you talk about what food as medicine means to you and the community that you're working with?
Sure. I work with Urban Growers Collective, and this is very much around growing food. growing food, getting food to communities, to ourselves. We're part of the community. We're not separate from the community, which I think is very much in alignment with what Ade shared as well. Chicago is a very diverse city in so many ways, so it's a great place to model different pathways. We're also headquartered of most of the food manufacturing companies in the world. So there's just a lot of opportunity to change and to have discourse around some of the opportunities to shift the ways that we process food, ways that people interact and understand how our bodies are not the same. We're not one size fits all.
Right.
Different epigenetic histories, and our bodies react to sugar, react to things that we're told are healthy differently. Stress and chronic stress has a different reaction. These are all things that we know in our work, and why having safe spaces where we can kind of get grounded, and it's not just a hippie term. It's literally,
Right.
I can walk into the gates. Of course, Alice is our mother of this understanding. Walk into a gates of a beautiful space, have a moment to interact with a plant. There might be gunshots echoing somewhere else, but I'm in a space, I'm in the garden. I can sit down and eat with my chosen family, with peers. Maybe I have an abusive situation at home, or I've been incarcerated. So I have disordered eating. I have disconnection with other people. And, I'm dealing with generational poverty. And so we're trying to remedy food as medicine as a prescription, which of course it is. It's important to prescribe healthy foods and whole foods and the proper proportions on our plate. But it's also a much larger issue that is environmental, that is historic, that, we must address structural racism. We must address displacement of our traditional food pathways. And that's global. That's not just the Americas. That's
right.
global. And that is a big part of the work that we do. I have a quote from one of my dear, I have some friends who are doctors, Dr. Gita Maker-Clark, who does integrated medicine work here in Chicago.
And wonderful.
She's just so awesome, and she's a partner in our work and has been consulting with Urban Growers Collective for the last few years. I met her through the Castanea Fellowship, so just an amazing lineage of intersectionality of all of our work. But this quote, most of us are only a couple generations removed from a culture that treated food with great respect and as a source of healing. It's possible to bring that tradition back into our culture. And I would add to it, food as medicine cannot be separated from public health and the
Right.
socioeconomic challenges and epigenetics that are not one size fits all. And, I think that for our young people, some of the programs that she and Dr. Sonia Oyolo at Endeavor Health at University of Chicago, they've been leading these programs for about 10 years. In Englewood, we've also worked with another program out of University of Chicago with folks with chronic health issues, ambulatory issues, who have to go and, have an emergency that could be treated as an outpatient, but wait because of all of the stigma and because
Right.
how we're treated when we go into the medical institutions. And so we end up going to the emergency room. But with community, with better relationships, with this community of practice, that can actually be facilitated in the garden. We've created a program using the garden as an extension of the medical office. Dr. Gita Maker-Clark's program is also really powerful and a connection to the farming work that we do, because she's training future doctors around using their power as clinicians to teach their patients how to cook and to do this with children at the school level. So those are things that are all really powerful. The Food is Power program. There's so many examples. We have an herbalism program. So many people are interested in learning about plant medicine and building their capacity to be well and to not wait until there's illnesses, and
Right.
to quality of life in the environment.
All so inspiring, so great what's happening in Chicago. Thanks to you, Erika. And I think what you've been talking about, using the garden as an extension of creating systems for better health, leads me into what Chef Alice Waters has been doing with Edible Schoolyard. It's your 30th anniversary, isn't it, Alice? Congratulations.
It is. It is.
And it's fantastic work. Can you talk to the audience a little bit about the power that school gardens have on the kids who are engaged in them, but also the whole community? Referencing back to what Erika was talking about, how this has to be sort of community based.
Well, I think you probably know I'm a Montessori teacher. And so I believe that our senses are pathways into our minds. And if we aren't using our senses, we aren't experiencing the beauty of nature, of the world. And it's so great that food is all about that. And I just knew that when I started the Edible Schoolyard, that I wanted it to go all the way. I wanted it to be a place where they're learning their subjects of the school, and they're learning through their senses. So they could be having a class in the garden, a science class, but they could have an art class out in the garden, and using the kitchen as a place where it might be a geography class, and you're studying the Middle East, and you're making hummus and pita bread and greens, and you're experiencing what grows in that place in the world. And I've just watched the kids just wake up when they learn about that. They want to go to the Middle East. They want to go to Tokyo and eat sushi. And it brings us globally together just by its very nature. But I think that it was been most important that it's not taking away from the academic curriculum. And here we are, and I thought I just hold up this map because there are 7,000 schools around the world that have adopted this idea because they have heard about it. But it's because it's about human values. And so it fits everywhere. I mean, it fits in hot climates and cold climates, and any place in the world. But I think it's a way to really teach the values of our democracy if we're sitting at the table and sharing food. People have talked about this, everyone on this panel, that it really has to do. It can't be by grabbing it. You've got to sit down and eat it and share it together.
Absolutely. Thank you for that. And teaching the values of democracy, really more important than ever. Kathleen, if I can turn to you, Ade, Alice, and Erika have really talked and really indicated that we need this holistic approach to support the health of eaters. But you have said to me that guardrails are also really necessary so that we don't stray away from the fundamentals of a healthy diet. And I'm wondering if you can explain that a little bit more.
Sure. Good morning and a great panel. Fun. I see this food as medicine interest out there as a huge opportunity, and I don't want that opportunity to be wasted.
Right.
And some of the focus of people who are advocating food as medicine seem very much old school in that it's there's some supplements that are trying to take over the conversation. I'm not against prescription meals, but it's a very medical approach. And, my mom was a nurse and a nursing professor who was very interested in alternative medicine, holistic medicine, and I think that's really how we have to think about this. We've heard some great comments from the panel members. We see some chefs Alice, you know, who are moving to a community table concept in the restaurants because we know that food is more than just nutrition. It's about culture and it's about connectivity. And I don't want to lose that in this grand opening of a conversation about food as medicine. I think we need to think in bigger ways. And, you know, just having been a mom to a son who was a vegetarian pretty much from birth, and then when he got to be in high school and he was wrestling, he was a bro, and then all of a sudden I see him bringing in all of these, you know, protein supplements and all this kind of stuff, and I'm worried about how much lead is in it, and I'm like, that's not the way we want to think about food.
Right.
So I think that as we go forward in this conversation, being somewhat disciplined about how we define it. And of course, we've heard about indigenous foodways already in this conversation. And living in Arizona, as I do, where so many of my neighbors and colleagues are indigenous peoples, I do a lot of work in Hawaii. There's so much knowledge there to tap. And I just don't want us to lose that from our viewfinder. It should be centered to what we do.
Absolutely. I couldn't agree more. Thank you for all that. And, you know, you've taught so many of us, and I know you're teaching your students different ways of thinking, and having this approach is really important, to think about it holistically, to think about what shouldn't be lost, and what kind of knowledge should be uplifted. Kofi, if I can turn to you, you know, Kathleen has talked about the opportunity we have with food as medicine. And, you know, we're shifting gears a little bit because you are both a pediatrician and also work for Elevance Health. Can you talk about the growing interest that the insurance industry is taking in food as medicine?
Yeah, it's a great question. So I work at Elevance Health, as you mentioned, which previously was known as Anthem. We have over 45 million members around the country, commercial, Medicaid, and Medicare. Within Elevance Health, food as medicine has been a concept for many, many years before, mainly thinking about through a lens of food insecurity, mainly thinking about through a lens of provision of food in different forms and fashions. Our foundation has done a ton of work as well. We've done a lot of work with our employees. But my role was created about 2 years ago. And 2 years ago, the plan was figuring out how we can create more cohesion across the enterprise, amongst commercial, Medicaid, and Medicare, how we can think about this work in a more effective way, building out the research, building out the more effective tools on the ground. Why is that? Well, when you look across the board, what we've seen is quite consistent. We've seen this common trend across the board of diet-related chronic conditions continuing to increase. Prevalence continues to go up and up and up. We also see morbidity and mortality, so decreasing quality of life and decreasing years from life, also increasing as well. So what can we do to really respond to this? Individuals, members, patients, families ask for tools using food in clinical settings. They're asking plans, how can we tap into these tools? So I believe that the role of a lot of the payers has been, hey, how can we now respond to this need, to this necessity that's been out there? So I think that that's one of the things that we're seeing across the board. Within our company, we're getting a chance to respond, again, across the board, recognizing that food as medicine doesn't only sit within Medicaid or Medicare, right? And even if you think about it, so Erika defined food as medicine from her lens, and from our lens, we look at the term food as medicine as strategies or interventions that work alongside healthcare that give access to high quality, nutritious foods, focused primarily on three things: prevention, management, treatment of disease, even putting diseases into remission, right? How can we work alongside healthcare, providing high quality food to prevent, to manage, and treat disease? Under the umbrella of food as medicine, we think about food insecurity, nutrition insecurity, and diet-related chronic conditions. Right. So at the end of the day, oftentimes people only think about food insecurity, nutrition insecurity, but the reality is the prevalence of these conditions are far more widespread than only households that are experiencing food insecurity. And it's important that we use the tool of food as medicine, the holistic tool of food as medicine, in that kind of way. Let me mention one other thing. Kathleen really highlighted this, and I think it's really important to understand. When we talk about food as medicine, I think it's very easy to be very prescriptive. Right. This condition, here's some produce, here's an apple, 2 berries, and a juice, whatever, right?
Sure.
But at the end of the day, if we think of it and approach it in that way, that's not going to move the needle in what we're trying to do. I think we have to take this holistic approach. For us, we start with food as medicine coming out of the whole health lens, right? So whole health, recognizing that within the four walls of my clinical setting, only such a small part of the impact on the health outcomes of my patients is happening within the four walls of clinical settings. We have to be aware of these other factors outside of the clinical settings where people live, play, pray, work, eat, sleep. These environmental circumstances, social, economic, social drivers of health, some would describe them as, these factors are critically important. So we have to take that into account, recognizing what the personalization of food, that people eat in different ways. And these all factors are really important in how we think about it, how we approach it, how we're trying to change the jargon, and how we're talking about it with our patients, our families, our members as well.
So important. We've heard from all of the panelists about this need for a holistic approach. And Kofi talked about creating more cohesion, more effective tools. And Rachel, that, makes me want to turn to you. Obviously in the last few years, we've seen a lot of excitement around food as medicine in the public sector. And I wonder how you see that momentum that has been created around food as medicine, carrying over into the new political administration, the new head of Health and Human Services. How is this fitting into the current priorities?
Yes, thank you so much for that question and for the opportunity to be here today. I mean, as all, the other panelists have shared different perspectives, food and nutrition is so fundamental to our health. And that is, something that at HHS we recognize very deeply. So this year we will have the 10th edition of the Dietary Guidelines for Americans that will come out. And we really see food as medicine as one of the tools to help implement the dietary guidelines. And it's really, there's very many different perspectives and how it can be implemented. And we see it as, a range of approaches that really promote optimal health and healing to reduce disease burden. And there's many ways that individuals can be connected to that food. And so how from, the lens where we sit with different policies and tools at our disposal, how do we really incentivize and help to promote those fundamental nutrition messages that are based on science and the dietary guidelines, and to help just, to create that important message and energy around food. And we just see that continuing with this administration and will continue to do so.
That's very hopeful. Can you explain just briefly to our viewers and listeners what the dietary guidelines are so that we, everyone's on the same page?
Yes, I'm happy to. So the Department of Health and Human Services and the U.S. Department of Agriculture, every 5 years, take a look at the science on nutrition, and based on the preponderance of evidence, issue guidelines and guidance to help consumers and health professionals understand what to eat and drink to best promote their health. And so by statute, they come out every 5 years. And so this will be the 10th edition of those dietary guidelines.
Thank you so much. And Kathleen, if I can turn to you, you've worked on the 2010 dietary guidelines. And I'm wondering how you look at this process of making sure that food as medicine can really be a part of that, like an important and strong part of it.
Well, we do these dietary guidelines, and the important moment in 2010 was the discarding of the food guide pyramid and doing myplate.gov, where the central message visually is half a plate of fruits and vegetables, which I thought was really great. But we know that Americans are not following those dietary guidelines to the extent they should be. They're still really important because a lot of government programs and how we dole out nutrition assistance are guided by the dietary guidelines. But we want more Americans to adopt the dietary guidelines. And so I think having this broader conversation about the role of food in our lives, it's not just physical health, it's mental health, it's community health. So I think, that may bring those dietary guidelines alive for more people. That's my hope.
Yeah, they really do need to come alive in different ways for folks. Erika and Ade, if I can come back to you both. Food access is important, but what we're really need to look at in so many ways, and Erika, you mentioned this the last time we talked, is consistent access. And I'm wondering if you can both sort of talk about what that means for each of the communities that you work in.
You said both of us at the same time. So, I'll start. I'm already talking. For the work that I am privileged to lead, it's growing food, growing.
Mm-hmm.
A little bit different than the work that my dad led with Growing Power, which was all about production, and community, to prove that we could grow a lot of food, that we could create a different kind of food system, and that it could be something that could look like, but be run by us instead of the traditional, conventional food system. What we've been doing in Chicago is really a decentralized food system, so that we have food not only year round, that's of scale, but is decentralized and valuing every scale. So the person who can put basil on their windowsill can add that to flavor something, to stick with those food guidelines. So somebody who can get a Fresh Moves mobile market, prescription for help from their primary care physician, to actually have that access, because we can't tell people to eat healthy if they go and they can't afford the food that we're telling people to eat. So the access piece is part of that emergency end of things. And then a regenerative component, and I'll use this word that is suddenly popping up, that I'm trying to understand what that really means and how it's connected with these words, around having mutual aid, having ways that people are seeing themselves in the food culture everywhere, and that has to look like not one thing. So we do a lot of different strategies: community gardens, allotments, making sure youth are at the center. They're learning how to grow the food, that they're learning how to eat the food, that they're learning how to sell the food, create things out of the food, make art with the food, that they're seeing that within the context of their lived experience, and they're bringing that into their familial life, their community life, their academic life, their social.
Thank you. Dave.
Yes, I love what Erika said and what Kathleen said. I do understand like these concepts of nutrition, of diet, of the food plate, and to me these are tools that are meant to help us, but often I think we're operating within a food system and a medical system that is very much based on the idea of professionalism and like expertise. Part of my job and what I'm learning from tribal communities is that there is a sovereignty that communities and people have that is often undermined by some of the capitalistic, the economic, the medical approaches that we have to how we eat, when really like the way we learn about eating is often through our families, is often through our communities, is often how we interact with one another. And so like relegating that kind of power of decision making and education to an institution outside of the community really does damage, not only to the community, but where that food is coming within that community. So it may be to the environment or to the water, and it creates like blinders to what is actually happening in our immediate environment. And I would like what I'm learning from tribal community and indigenous people is like those skill sets are very much tied to what we eat, like how we see our community, how we understand, and how we listen to one another. All of those things lend themselves into the diets that we create for ourselves, but for our communities, and affect everything around us. And so when I think about like the dietary guidelines, when I think about how we describe nutrition, all of those things are meant to be tools. They're not meant to be like the end all of how we describe what we eat. Like part of that requires some skill sets that often been targeted and diluted from very specific communities in our country. And so part of like the sovereignty in this conversation is exactly what Kathleen said, is like we have to expand and really understand how we use these tools in very specific communities, in very specific dining tables and the
Sure.
histories that are connected to those places.
Can I add one thing?
Of course.
Pot liquor is a great example. You know, pot liquor is the root of it is the medicine is in the broth. You know, and it got demonized because we put pork into flavor. And we're talking about survival food during enslavement. And that history, that culinary history, and the importance of those foods, um, no one gets hypertension from pork flavoring and greens. If your primary food is vegetarian based and you're flavoring, that is not the root of hypertension. But we've been taught that. So, but the pot liquor has the nutrient, has the minerals. There's so much information that's lost. All the herbs, the plant medicine that goes into the greens. It's not just what you buy at the grocery store. It's foraged greens. And those are things that our great grandmothers and grandfathers would do every spring. There's all this knowledge, indigenous knowledge, that we learned and through our families throughout 400 years of history, just in this country, just survival in this country. It's part of our medicine and again, our epigenetics, which I think is really important. And that's something that is part of story. It's part of, you know, it's just part of what we learn within our families. It's part of our medical history. So I'm really passionate, and I'm really just want to double down on what you just said.
I always love your passion, Erika, and I think, you know, the cultural and historical relevance has to be part of what we're talking about here because it matters so much to communities. Alice, I want to come back to you for a moment and really dig down into something we've been hearing about throughout the panel, and that's the connection between a more nutritious food system and the impact that can have on the environment. Do you want to talk a little bit about that connection?
I never like to talk about food as medicine because food is about taste. It's about connection to the season. It's eating that way that connects you to nature, and it's all about the soil and how we take care of it. And it's something that is irresistible to children. I mean, they can say they don't like certain things, but if you pick it off the tree and you cut it up, they'll eat it and they'll love it. And it's really, my restaurant has absolutely been based on seasonality completely. And also connecting with the farmers. We were lucky that we connected with Bob Kennard, who's a regenerative farmer. He tried to tell me that his food was 25% more healthy for me than any other organic food. I didn't believe him, but it is. And it's because the regenerative, allowing the soil to have everything in it needs, it pulls down the carbon from up there and puts it in the ground. And so by eating this way, you're addressing climate. You're obviously addressing health, but you're really engaging with nature's beauty and bounty, and that changes your life.
Absolutely.
I think Jose Andres, when he ate at the restaurant and he ate a date, he said, I've never had anything like that. I thought that wasn't a real dessert, but I ate one and it changed everything. And I've had that experience. We need to know you have to let food ripen on the tree and then pick it. And it can't be shipped halfway around the world. So it's eating exactly where you live, which we did before 1950. And so we can do it again. And I think it's what we have globally in common is food and education. And what if we only fed children the food that's locally, organically grown, regeneratively too? You know, the mayor of Paris decided she was only going to buy food for the schools. This is more than a year